KDF training. Whoops. Oh, sorry, there's a little pop-up. We are live, by the way. So for our Norton Sports Health training program for the KDF Mini and Marathon. As always, you guys can join in as we're going, as we're talking, and this video will be posted in the Facebook group by tomorrow afternoon at the latest. So if you can't join us here live, you can always catch us later on when we post it the next day. So we talk about a lot of different things on our Tuesday talk. We are at week 5 or 6 right now. I'm a little confused on which week. And there's a lot of snow. So hopefully you're still getting your runs in and still getting some sort of workout in, whether you're on the treadmill, running stairs up and down in your house, or just doing a bunch of squats and lunges. Either way, just keep moving. Don't stress about it. There's always going to be weather issues. So today's topic for Tuesday Talk is common aches and pains as you begin training. There's always those little aches and pains that kind of creep in when you start running or when you start adding mileage. And we want to find out if that's just little common aches and pains like growing pains, or if it could be something that is potentially going to lead to an injury, or if it's an injury right from the start. So we want to talk about those things today to make sure everyone's staying healthy. And we just want to distinguish between those common aches and pains that happen in runners. So quick little housekeeping on our Zoom. Everyone is muted. And we want you to use the Q&A section on the bottom of the screen there. So anytime you want to ask a question, anytime, starting now, Q&A section, throw a question in there. We will get to it at the end of the program after we get through our presentation and some of the Facebook questions that we initiated. So use the Q&A. I will yell at you to do that a couple times throughout the Zoom. Also, this Zoom is recorded, obviously, so we can post it later in the Facebook group, just so you know, but nobody's on camera and everyone's mute, so no worries there if you're wearing your pajamas. All right, so let's kick things off with our first Tuesday talk. It is Dr. Robin Curry. You can see her there on the screen. She is a sports medicine and non-operative orthopedic physician with Norton Orthopedic in St. Matthews. So if you've been out to St. Matthews with any pains, you may have there along with a few of the other doctors that we have on staff. Dr. Curry is an avid runner and has served as the co-medical director of the Kentucky Derby Festival Mini Marathon and Marathon since 2015. So she knows her stuff. She's been at the finish line there for a long time. She also served as a co-medical director for Ironman Louisville, and I know that for a fact because I saw her at the finish line. And Dr. Curry is the head team physician also at Bellarmine University and serves on the medical advisory board of the Atlantic Sun Conference. So if you're a Bellarmine fan, whoop whoop. She also was a prior board member for Girls on the Run Louisville, and she has a passion for treating runners of all ages as well as female athletes. So welcome, Dr. Curry.
Thank you.
So just a couple things to start out. I know you have a really great presentation to go over some of those common aches and pains. So before we get to any of our questions, let's just talk about those common aches and pains that kind of creep in when you start training.
Right. So I tried to think about all the things that I see in the office, right? So we get kind of a wide variety of athletes. I get those runners that have just started running, which I'm super excited about. And then we get those athletes that have been playing for long periods of time, for years and years and years. And everybody gets some aches and pains at some point. And some, like you said, some are normal, right? You're exercising more. We expect that you're going to have a little bit of soreness, maybe soreness during the run. And then you wake up the next day, doesn't feel too bad. And then 2 days after, it's gone, right? Those are things that we don't worry too much about. It's that lingering pain, those sharp pains that persist days and days and limit your ability to do those runs or to do that cross training. So those are the things we worry about the most. All right, so I'm going to go ahead and start this presentation. Is that good for you? Okay. I'm going to share my screen. I apologize, I'm not very tech savvy, so hopefully you guys can see this. And I'll also apologize if my children run into the room since they're home on a snow day. So I apologize. Hopefully they won't. Alrighty. So like I mentioned, running hurts sometimes in various different locations. It can hurt in your back, it can hurt in your legs and your knees and your ankles. And so we're going to kind of go over some of those common aches and pains. So this is probably the most common injury that I see in the office. So, known as runner's knee or patellofemoral pain syndrome. So that's pain that we get in the very front of the knee. And I see this of runners in all ages. Again, those beginner runners, and then also runners that have been running for years and years. And we see it in all age groups as well. It is more common in women. And it kind of just gives you this diffuse pain in the front of the knee. Oftentimes it's worse when you go from a seated to a standing position. So if when you're sitting in a chair for a long period of time and then you stand up and you feel that pain, really common, pretty classic for this. We call it the movie theater sign. But I would say of all the injuries I see, this is going to be the one that's going to be the most common. And it can be kind of a dull, achy pain, can be constant, or it can kind of come and go as well. The reason that we get this is a weakness issue. So that's where the cross training comes in and the strength training comes in, weakness in those supporting muscles. So we used to think it was all just your quad muscles. Now we know it's your hip muscles. We know it's your core muscles. So you can't skip those core workouts. Those are really important in order to stabilize that kneecap. Other things are going to be changes in training. So whether, again, you're just starting out or you're increasing that mileage or increasing that distance, that could cause this to start as well. And then high arches, flat feet, those play a role here. I showed the picture here of just that increased Q angle. That's in women. So again, another reason we see this more common in women. So we think about how we manage this. It's all therapy exercises. So again, doing that cross training, riding that bike, strengthening all those supportive muscles, having somebody take a look at your feet. So that's when it's good, to make sure that you get fitted for those shoes, make sure that you have the appropriate shoe for your type of foot, and making sure that you don't have too much mileage. So that's really important. Changing, wearing shoes too long is another cause that we'll see for this as well. And here are just some exercises, again, stretching those quad muscles, working on the core, working on those knee stabilization exercises. So kind of moving down. So another thing that I'll see frequently, and I think a lot of runners have experienced this. I may not realize that it's this, but it's IT band. Two places. So we see it in the knee. We can also see it in the hip because it attaches on the hip and runs all the way down to the knee. We'll see it sometimes if you, and here's a picture. So this with knee pain secondary to IT band syndrome, that's where you're going to feel it. So right where that circle is. So it's on the outside of the knee. We see this again with changes in running. So like if you're doing more hill workouts, or if you're running on the same street, say you do the same workout and it's kind of tilted a little bit and you go the same direction each time, that's going to make it more likely that you'll end up with IT band syndrome. So important to change your route. So don't run that same route every single day. You need to mix it up a little bit, especially if you're running like on the sides of roads. So again, some other causes, and you'll see this, a lot of this is going to be changes in your training. So I'll say that over and over again. Also for patients that overpronate. So if you've heard of that term, I put this picture because I think it's a good way to show that, where those feet turn in whenever you run. And that's, you'll see as we go throughout this, that's a common cause for various different running injuries. And then that hip abductor weakness. So working on those hip muscles is really important as well. And same thing here. A lot of the treatment for most of these things that I'm going to mention here are going to be just therapy exercises. And a foam roller can be your best friend as far as really stretching that IT band and stretching out all those other muscles in the lower leg, anti-inflammatories if you need to. And here's some good IT band stretches as well. I'll put this in here so you can go back and look at it if you have a moment, but these are some good stretches also. And then this is probably behind kind of that runner's knee. This is one of the most common things we see too, especially in those beginner runners. And this is where it's really important to try to determine whether is this just a nagging shin splint of that stress reaction or stress fracture, right? And so this, again, is all an overuse injury. It's really pain that you get below the knee. And so there's a lot of, I guess, controversy about what the actual cause of this, whether it's a bone issue, whether it's a muscle issue, what the cause is, but it's very, very common in runners. And so again, it can be sharp, it can be dull. With this, as opposed to stress fractures, that pain is going to be more diffuse. So all throughout the lower leg, rather than that point tenderness where you can find that one spot that's really tender to the touch. Sometimes it'll get worse if you're standing on your toes or rolling your ankle inward as well. Again, here's what I mentioned, where there's no clear consensus on what causes it, whether it's those tears of the muscle or whether it's inflammation around that tissue that surrounds the bone, or it could be a mixture of both. Risk factors for this, again, just starting running, increasing your mileage, changing your surface, increasing your speed, all those things. So especially as you add those speed workouts in, all of those changes can affect your body's ability to cope with that and cause some symptoms here. And the treatment, again, doing some activity modification, so adding in some cross training is really important. You can do that in a pool, you can ride a bike, but trying not to just do the running, but making sure that you're adding in those other activities as well. Always take a look at your feet. Again, like I mentioned, that's the most important thing that can make a huge difference. So have somebody check out your feet, go to one of the running stores and have them take a look as well. And there's some stretches, again, some towel stretches, and just working on stretching those calves as well. And then stress fracture, again, is kind of that next step beyond those shin splints. So it's more of damage to the bone rather than those other tissues. And you'll initially feel it during activity, and then it'll kind of persist. And you'll notice, especially at nighttime. So that's something that I always ask patients is, do you feel it at nighttime? Do you feel that dull, achy pain that wakes you up at night? And then it's just with you all the time. And then again, that point tenderness. So finding that one spot where it's really tender to the touch. And causes, again, it's various reasons, but increasing the training, increasing the distance. And I did want to mention this kind of relative energy deficiency in sport. So in women, we used to call it the female athlete triad, but making sure that as you guys are increasing your mileage, that you're also getting enough energy as far as calories in. So it's calories in has to balance all the calories out. When that doesn't happen and we don't pay attention to that nutrition, and that nutrition aspect of our training, then that's when we become more at risk to get these stress fractures. And you can see you can get the stress fractures at various different points in the leg. It can be in your hip, it can be in your shin, but also see them in the feet. So making sure too that you're getting some calcium, vitamin D, especially in the winter. So that can be very helpful to help prevent against this, and just paying really close attention to the training and following the training that our program has lined out so that you're increasing that mileage at the right time and the right amount. So again, treatment for this with a stress fracture, it's just going to be rest. So it's pretty simple. Rest and give it some time. Sometimes you need a boot, depends on where the fracture is. Then moving on to the feet. So plantar fasciitis is a really common injury, not just in runners, but in people really of all ages. You can see this picture here where you have that big fibrous band that attaches on your heel and goes and spans all the way up into your toes. And so usually when we see plantar fasciitis, here's a nice picture of a foot. This is where people are going to feel it, where that ring is. It's less so in the arch. I think a lot of patients seem to think that they expect that they're going to feel it more here in the arch, but actually it's down in the heel. And pretty classic symptoms when you get out of bed, if you have that severe pain, that's really classic for plantar fasciitis, because that foot's been in that same position all night, and then you go to take those steps and stretches out that fascia, and then you get lots of pain associated with that. And this is the most common cause of heel pain in runners. So we see that pretty frequently. Again, goes back to that footwear, making sure you don't have too much mileage on it, making sure that your calves are stretched and that you've got good range of motion in that foot and ankle, and working on all those therapy exercises that can help that. The good news in all this is that if you do nothing for plantar fasciitis, in 1 year, it'll be gone. But in 1 year, that's a long time. So that's a lot of races in that 1 year time to have to run and kind of suffer through that. So we like for patients to get better before that. So we do that with some rest. You can see the picture here of kind of rolling that frozen water bottle on that foot, doing some rehab, using some heel cups or pads, orthotics. And then you can get something called, which is a night splint, but I like one called a Strasbourg sock better because it's less restrictive as the night splint, and that can help kind of alleviate and stretch that fascia out all night while you're sleeping. And there's some therapy exercises. So stretching that Achilles, working on that towel pickup to work on those muscles in the feet. Then lastly, the Achilles tendon. So this is, again, a common one in beginners and also more advanced runners, just an overuse injury of that Achilles tendon. And finally, something that's more common in men because so many things that we see are going to be more common in women. This is actually more common in men. And this is a picture here of where we expect that you can see pain when you have Achilles tendon issues. So you can have them both in the red here. That's kind of in that mid substance of the Achilles, and that's where most Achilles tendon injuries are going to be. Whereas the one in purple, that's going to be what's called an insertional Achilles tendinitis or tendinopathy. And those are much harder to deal with versus the ones that are going to be kind of right in the middle. And again, things that can cause it are those recent change in training and recent change in shoes. And that's why, again, why it's so important to kind of stick with the plan and not do too much, even when you're having a good day and you feel like, oh, I can push it. There are consequences to that sometimes. So make sure you follow the direction of the plan. That's why it's there. Risk factors, again, another example of that overpronation. So that's another risk for Achilles tendon injuries as well. And so treatment, just some rest, anti-inflammatories, and some eccentric exercises. So here's a picture of that where you're loading that muscle. And then you can use some heel lifts. And there are other things you can do for Achilles tendon issues as well. Like you can do some types of injections like PRP injections. It gets pretty advanced. Topical anti-inflammatories can help with that as well. That's all I have as far as from a presentation, and we can go over kind of Q&A. And I wanted to leave my presentation with this because this is my favorite quote from Steve Prefontaine. It's hanging in my workout room in front of my treadmill. So this is what I always take a look at while I'm running. Alrighty, I'm gonna exit out here.
Awesome. So that was a lot, but you hit every single question and issue that has typically been brought to my attention with the IT bands, the runner's knee, the shin splints, the Achilles. I mean, it's kind of across the board the same thing. So I was taking some notes as we were going through. There's a little relation here with some of the Facebook questions that we had.
Great.
So I did have someone say that they did hurt their IT band when they were trying to go out and run on the snow and ice. So was that probably just due to the uneven ground?
Yeah, absolutely. And so when you're running and you're really paying attention to the surface that you're running on, right, and you can't get your normal gait pattern, you activate muscles in a different way. Could have been uneven, or again, where you're kind of tilted from one side to the other. Add extra stress to that IT band, and it'll flare up, again, both in the hip and also in the knee. So we'll see them in both locations for sure.
So a treatment for that would just kind of be like the Rice method right now, maybe a little foam roll.
And then use the foam roller as tolerated. You can also use a topical anti-inflammatory cream called Voltaren or diclofenac cream. And you can rub that directly on because it's pretty superficial to the skin. So you can use that really up to about 4 times a day, as long as you can take anti-inflammatories, but helpful as well.
Cool. Okay. And then you talked about some of the Achilles tendon issues, and I did have a question on Facebook that actually was from Dana, and she actually asked the same question last week, and we're still kind of working through the different things that go along with it. But she says she's been fighting some strange pain back there for about 4 weeks now. It feels like the back of her right ankle is rubbing against her shoes, like she doesn't have socks on. So that's probably that purple area you spoke of with the insertion point, right?
Yeah, absolutely.
She's been doing the push against the wall stretches, hanging the back of the foot off the step. She does them every day. She runs in Brooks Ghost 13. I don't know if they're new or old, or maybe they don't fit her right. Any suggestions?
Yeah, sometimes, you can get pain at where that Achilles inserts on the heel, but also there's a little bursa sac that sits back there. It's a fluid-filled sac. And so it can also get irritated. So you can get some bursitis as well. And it may be that, and that will be really tender to the touch. And that can happen. I would say I'd really take a look at the other shoes that you're wearing, other than just like your running shoes, because other shoes, especially like heels or other things, can rub up against that area and cause some inflammation. And so take a look at your other shoes is step one. If it really is the bursitis instead of the Achilles tendon, which would really be a better case scenario, again, you can use that topical anti-inflammatory cream because it can really help, because it's so superficial there. There's not much tissue back there, but that medication really penetrates that area well. So maybe try that and see if that can provide some relief. Those are tricky. If it is the Achilles tendon, it's tricky when it's down at that attachment site versus when it gets higher up. So it can persist a little longer than we would like it to.
Okay, and then we did talk about shin splints. I think the main method there to treat is again the
Right.
rice method. Yeah. Okay.
Yeah, absolutely. And just paying attention to that mileage. I mean, it's all increasing your distance, increasing your speed at the appropriate rate, and not pushing it because you're feeling like you're having a good day. Just follow follow the plan, and that can make a big difference. And shoes, just looking at those shoes too, making sure somebody takes a look at those. Don't feel that you have to go and buy them online. It's so important to have somebody look at your feet and have you, get fitted for them and make sure they're the appropriate kind for you.
Yep. And while I'm going through these questions, just throwing it out there again, guys, Q&A section there. I got a couple questions in there waiting. Put them in, ask your questions. Now's the time. And I did have another comment from Facebook about signs of potential injury versus the growing pains. So how do you distinguish between just those common aches and pains? I'm going out for a run and my body kind of hurts today versus pre-injury or approaching injury.
Right. So one, which I mentioned before, is that if you feel like it goes away the next day, like if it's gone the next day, just a normal soreness. But if it hurts while you're doing the activity, that's definitely to be expected. Like running is fun, but it hurts sometimes, especially as you increase that mileage. So that if it's gone the next day, or if it's, maybe it sticks around a couple of days and then it's gone, that's okay. The sharp pains, in certain positions, especially like when we think about knee pain, if you're getting some knee pain and you are pivoting on it and you have pain, or you feel like there's instability in any joint, whether that's in your knee or maybe that's in your, in your ankle or your foot, that's not going to be that normal soreness, that normal, pain that we would expect as you increase that mileage. So definitely go get that checked out. If it's pain that wakes you up in the middle of the night, that's not just a regular soreness. And sometimes more of those kind of dull, achy pains that are pretty mild, that low level, those are okay. But it's the one where you're getting that sharp stabbing pain, especially with certain movements, again, of the hip or of the knee or of the ankle, then those are going to be the things that we worry more about. And I always say, if you're worried about it, just have somebody look at it, right? Because what you don't want to do is kind of push through and then realize like, oh, actually I had a much bigger injury I should have dealt with earlier.
Yeah, and then that kind of takes me back to the runner's knee, which is super common. I have it myself. I've had it in my left knee forever, and I just know it's runner's knee. I know that sometimes it just bothers me. It is that dull pain, but the sharp pain and popping and things like that, those are all bad, right?
And I will say, like with runner's knee, a lot of people complain of kind of that crunching or popping whenever they flex and extend the knee, like going up and down steps. If that is painless, you do not need to worry about it. Totally normal. Mine do that as I go up and down the steps. But if it's really painful and popping, then that's a different ballgame. Painless popping is okay.
Right. And what do you think about KT tape? A lot of people, I see some people have 2 rolls of KT tape all over themselves, and I'm like, is that really working? So what do you think?
I would say, I think it under the use, like if you're using it because your physical therapist feels like it's appropriate, then that's a reasonable. I would not just go out and start putting KT tape in various places. I think that's probably mentally, it might be helping. It tells your body, hey, I've got a little ache there. I need to maybe pay more attention to it. I wouldn't waste my money unless my physical therapist was using it and was having some benefit, like with stability and that sort of thing.
Yeah. And then my last thing to bring up is the stress fracture section. Never fails. Every year, there's at least one person that comes to me a few weeks in and says, well, I got a stress fracture. They show up wearing a boot. So let's how do you distinguish between just pains and versus going like your pre-stress fracture versus you're actually in that stress fracture? How do you kind of distinguish that?
So if you're getting pain in the front of the shin and it's really along the whole shin, that's usually going to be more of those shin splints. So when it's more diffuse, even though it's a bigger space that we're having pain, that's actually better, right? And when the stress fracture, it's going to be that one spot. If you're like, oh, it feels great, just kind of press along your shin. If it feels great all along and then you find that one spot that's super tender, that's when we get worried about a stress fracture. And the same thing goes, I mean, if you've got a point tenderness in your foot, right? Because we see foot stress fractures as well. then have somebody check that out, because especially along the outside, or what we call kind of that fifth metatarsal, that's a common place to have a stress fracture, especially in runners. So if you've got point tenderness on any of your bones, that's concerning. But more diffuse pain, that achy pain, and that's going to be more along the lines of the shin splints. If you're getting nighttime pain, so that's a big one. Shin splints should not cause you significant amount of pain while you're sleeping at night. So that's also a clue. You can also do that hop test, stand on one foot, hop up and down. Does that really cause excruciating pain? Probably pushing towards that stress fracture. And you can get kind of that beginning stage of a stress fracture, which we call a stress reaction, where those symptoms are going to be mild. So it's not always going to be this horrific pain. And certainly if you can catch it earlier, then it's less time away from running and less time away from your activities.
Yeah, let's avoid the boot. Okay, so I saw there were a lot of really great stretches and rehab exercises you had in your presentation. So guys, make sure you go back, look at those, work them into your weekly routine. It's really going to save you. We don't want to deal with injuries and pain. So focus a lot on the hip strength, the core strength, just to help stabilize yourself. And then of course, all those little rehab things, as those aches and pains start to creep in, maybe try some of those and see if they start helping you. And I don't mean try them one time and it didn't work. I mean, try it a few times for a couple of weeks. And if you notice that those pains go away, then that's going to help you out. So make sure you go back and look at those. And then, okay, so we have some Q&A here. Let's take a look at that. So let's see. I got from Nathan. I'm not sure what a niggle is, but I got a niggle exactly 1 week ago after a relatively easy interval run. Nothing too abnormal in terms of intensity. It's on the top part of my right foot between the middle back area, in line with the shoelace area. So there's no pain in contact, and he can do his calf raises with no pain. It's just when he, I guess, flexes and tightens his right foot. The shoes have about 275 miles, which is kind of a lot. So any thoughts or recommendations?
Yeah, so it sounds like it may be, especially if you're just noticing when you flex or tighten, you're probably activating the tendons at that point. So it could be some inflammation of the tendons. Sometimes if it's right under where that shoelace area is that the shoelaces could be a little bit too tight and putting stress on that area of the foot. So I would play around with that first and see if that changes anything. And then I'd really work on some foot like strengthening exercises. So we don't do enough of that, I think, as far as like strengthening all those structures in our foot, but maybe giving that a try too. But I would play around with the shoelaces first and making sure that they're not too tight. It sounds like you can keep running at this point.
And then it looks like we have our last question, which is kind of a perfect last question, because I do want to reference the fact that our next Tuesday talk is all about shoes. All of your shoe questions are going to get answered. I will be at Swags with Allie Vincent, and she is going to discuss all of the shoe questions. But we do have a question here about the importance of replacing the running shoes. At what mileage do you recommend? And also, would that mileage limit change if the person might be overweight?
Yeah, so I would say around like 200 to 300 miles is a good time to replace those shoes. But also just pay attention to your tread, and I'm sure they'll talk about that next week, but really turn your shoe over, right? And look at that shoe tread and see if it's completely gone, but you haven't hit that 200 miles, then it's time to maybe toss them and get a new pair. And when you are overweight, that loads everything more, so including your shoes. So I'd say it may mean that you need to trade them out a little bit sooner. Just pay attention to the tread wear. And we do that a lot too, just thinking about injuries, just looking at the tread and seeing where do people land, what kind of strike do they have. It all plays a role. But I can't stress enough importance on making sure that you don't put too many miles on your shoes. So important.
Yeah, and we will talk a lot about shoes. Like I said, a lot of great information coming up next week on shoes. We'll be at Swags Live. I'll actually be at the store, so we can show you different things and maybe test run a couple of different things. And you'll get a lot of information there on next February the 23rd. Don't forget to pre-register. You have to pre-register. So make sure you do that 2 days in advance. But Dr. Curry, awesome information. Perfect. You hit every question that ever comes to me, and awesome presentation. It was great, very informative. Guys, go back and look at those slides. And thank you, Dr.
No,
Gray,
you're
for
welcome.
joining us.
Yeah, happy to be here.
And everybody go out and try to get your run in. I know there's so much snow. I went for a mile walk in my snow boots with my dogs, and boy, that was a workout. So I wasn't even running. So you can get a workout somehow, I'm sure, doing something. There's a few suggestions in the Facebook group on what to do if maybe you don't even want to go outside or you don't want to get on the treadmill. So take a look at those. Keep moving. We have a pretty long run coming up for the mini and the marathoners this weekend. We're getting back at it hard this week. So let's get moving and stay healthy, stay well, and we'll see y'all next Tuesday.
Bye.